Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for taking a minute to watch this video. You're here because you're looking into porcelain veneers or composite veneers, and you're weighing the difference and the cost and what's involved and the pros and cons, and you're definitely in the right place, because a lot of people we meet with and see have that very same question, and the answer is it depends. And that may not be the answer you want to hear, but the prescription or the recommendation your friend had is probably not going to be the same one that you have. All right, but I can give you some basic guidelines of when we would do a composite veneer versus a porcelain veneer. Okay, so the first thing to keep in mind is the differences. Porcelain veneers are ceramic shells that are usually made in a lab or a milling unit, and they usually involve a couple visits. Sometimes they can be done in one visit. We typically do them in 2 or even 3 visits, because we want to make them precision matched to your smile, and so we have a ceramist that we send those to, and we do a 3D scan of your mouth, and or you may get like some kind of putty impression of your mouth. All right, but a lot of the newer ways are 3D scanned, which is what we like, and we'll send that to our ceramist, and it takes a few weeks, and they'll mill those out and come back, and usually they're finished. But sometimes if you have, an exceptionally difficult bite or a more difficult cosmetic match, then we may do a try-in first, where you get like a replica of them to make sure that they look the way you want them to look. All right, but I would say 9 out of 10 times that second visit they're finished and they're bonded to your teeth. The way we prepare veneers here is you don't have your teeth ground down to little nubs. And so that waiting game of a few weeks, it's not like you're walking around with these little teeth or a lot of changes in shape. In fact, most of the time, the visual difference that your friends or your spouse would see is nothing or almost nothing, meaning your teeth would look the same as when you walked into your dental appointment. All right. Composite veneers, on the other hand, those are bonded directly to your teeth. It's usually 1 visit. Sometimes it can be 2. And with any of these, usually there's going to be some follow-up visits for some minor adjustments or maintenance or those kind of things, all right? But ideally, we want to get your smile to you as quick as possible, but we also want to do it the right way, and you don't want to have these things rushed, because if they're done right, they should last for years, okay? Composite veneers are usually a resin is used, okay? It's kind of a putty that has a porcelain or glass matrix in it. It's little tiny pieces of porcelain ground up inside of composite resin, and it's kind of a putty. And you think about it like if you've ever seen nails done, acrylic nails, okay, and those nails have like chips in them, and you go to get a fill, okay, that's where there's some new acrylic bonded on there. It's very similar. The difference with tooth composite is it also has porcelain, little tiny pieces of porcelain inside of it, which makes it stronger and look better. Okay, so you have all porcelain veneers, and then you have a composite veneer, which is kind of a hybrid of acrylic with some porcelain in it. So it still looks nice. So both work well. If someone has like a chipped edge, okay, if you have like a chipped edge of your tooth, or a single tooth, it's maybe got a little bit of wear on it, a lot of times a composite veneer is better. So if you're prescribed a porcelain veneer, be careful, because a lot of times you're told it's a porcelain veneer, and then it turns into a crown, and then it turns into a root canal, and you have your tooth ground down. There's nothing left, all right? With the veneers that you should be looking for is called a no prep or a minimal prep veneer, and that's where little or none of your tooth shape underneath is changed. So that way the porcelain veneer makes your tooth stronger and it's bonded to better. All right. On the flip side, composite is great for minor repairs, or sometimes major repairs, or sometimes if you cannot yet afford the porcelain veneers, it's a nice transitional tooth, because composite veneers, we have a number of those that are years old, many years old, and they still look great. If changing your smile is your main priority, like you want a whole new smile, celebrity smile, or get your teeth back like they were when you were a teenager, or give you a completely new look, porcelain's usually your better option, okay? But if it's a tooth that chipped a bit, or there's an edge that's worn down, or maybe you just had braces and one or two of your teeth are a little bit off the shape you'd like them, composite's a great choice, and sometimes the preferred method of choice that we would offer you because we want to save as much of your tooth. And that really stays in line with what we would call a biomimetic protocol. Okay, and biomimetic is a modality of dentistry that you have available where it saves more of your teeth and you're not getting crowns and root canals and big fillings. Okay, we stay away from those things here. So with a biomimetic protocol, you're getting more of your tooth saved. You would get an overlay instead of a crown, okay? And then you'd get a bonded restoration instead of a big hole drilled in your tooth with a sharp burr and then filled, which can cause root canals, okay? And since we switched to this years ago, we have a third less root canals, much happier patients, and people's teeth just feel better. It's amazing. People say, that feels really good. My bite feels great. You don't have that big bulky crown that you have to keep grinding on and grinding on and grinding on. And the same thing can happen with veneers if they're not done correctly. So if you have some questions on this, let us know. We have a booklet on cosmetic dentistry. It's a consumer guide. So if you're going through this journey and you have some questions, you can give us a call or stop in the office. We have a few copies still available. I mentioned this on a previous video. We do get copies in, but they go pretty quickly. So if you'd like a free copy, just stop in the office. And if we're out of stock, we can ship you one or call you when we get back in stock. And we'd also be happy to answer any of the questions you have at this time or see if you need a consultation or a second opinion to go over your options. So thanks for watching this video, and we look forward to seeing you on the next one. Have a great day.